A message from us here at the Tuddenborough Dental Surgery in Ipswich. Feels a little bit surreal to make this announcement, but due to the current policy of social distancing and reducing interpersonal contacts, we are having to cancel all our routine appointments for the next 3 weeks, and let's hope that is enough. Unfortunately, we can only deal with the most severe dental emergencies, such as excruciating toothache, abscess or cellulitis, which cause a risk or pose a risk to the airways. We do not have access to the FFP3 masks and gowns, and neither does any other practice in Ipswich, unfortunately. This personal protective equipment is deemed essential if you are to have contact with the public. As a dental surgeon, you can appreciate that we are within a foot of the mouth and therefore spreading the virus either from us to a patient or a patient to us poses a real risk. In view of that, I thought it's a good idea to visit oral hygiene. Unfortunately, tooth decay and gum disease does not self-isolate, and we still need to follow our home care routines, and it's easy to forget that you need to brush your teeth twice a day for 2 minutes at a time if your routine is disturbed. Now, if you would usually have your breakfast and then as the last thing go and brush your teeth and get yourself ready to go to work, you're not going to work now, you get up, you go and brush your teeth, or you go and have your breakfast, and brushing your teeth, it is something that you forget to do. So it might be better now to get up, brush your teeth first thing in the morning when there is a much lower plaque level in the mouth, easier to clean the teeth more effectively, and then carry on with your day. And then again, last thing at night to brush your teeth before you go to bed. And I thought it was a good idea to sort of visit brushing techniques. We definitely recommend an electric toothbrush and a rechargeable rather than a battery operated brush. You do not have to break the bank in buying an electric toothbrush. What you want is a 2-minute timer and ideally a quad pacer. So it breaks the 2 minutes up into 30-second intervals. And that gives you 30 seconds to brush the cheek side of the upper teeth, the palatal side of the upper teeth, the cheek side of the lower teeth, and the tongue side of the lower teeth, spending 30 seconds on each of those quadrants. And the idea is that you spend an even amount of time on every tooth surface. It's easy to start your electric toothbrush and zip around to the other side and just sit there and think about what you're going to be doing for the rest of the day. Try and concentrate on what you're doing when you are brushing your teeth. You want to clean every surface of every tooth, as I've said. Pea size of toothpaste, fluoride containing toothpaste, and your toothbrush. So the technique that I use is toothpaste on, moisten it, and in the mouth before you switch it on. You don't want toothpaste all over the mirror in front of you. And start at one tooth at the back and sort of just slowly backwards, forwards, walk the toothbrush around, angling the bristles towards the gums. It's where the teeth and the gums meet where the plaque bacteria tend to grow. When you eat, the food scrapes away the biofilm and plaque from the chewing surfaces. So I'm going to see if I can time it perfectly for the 30 seconds to get to the other side. I couldn't, and I did. Then you go onto the palatal side, and you do the same on the palatal side. So backwards, forwards, backwards, forwards, backwards, forwards, backwards, forwards, walking it along to the other side, trying to time it so that you get there when the 30 seconds runs out. If you get to the other side too quick, walk it back again. Afterwards, spit out. If you're using a Durafat toothpaste, which is very high in fluoride, don't rinse out. You want the fluoride to stay on the teeth for longer. Then we've cleaned the fronts and the backs of the teeth. After the 2 minutes are out, you can quickly go over the chewing surfaces, which removes any food debris that might be on there. And now we've missed 50% of the tooth surface because the areas in between your teeth, you haven't cleaned that area. And there you need to either use TP brushes, little bottle brushes, or floss. So your TP brushes are more effective, and ideally you want to be measured up by your dentist or your hygienist to check what size TPs go into which spaces. There are patients that we have with a whole range of colours that they use. And the way to use your TP brush is I tend to bend it a little bit at the base, makes it easier to get it in at right angles with the teeth. And what you want to do is you want to poke it towards the gum and then underneath the contact point and clean through. Let's see if I can find one where, there we go. So you want to poke it through underneath the contact point. If you imagine my hands being your teeth, the contact point is quite high up. Down here is a triangle where the teeth aren't meeting before the gum starts, and that's where you want to get your little TP brush through, cleaning out the bacteria. Now, if you don't disturb the bacteria there, you get a population of mature bacteria which causes gingivitis. Gingivitis is a smart name of inflammation of the gums. So the bacteria in our mouths produces toxins and antigens which your immune system can pick up. The gum in the mouth is a very specialized type of skin, and the immune cells picks up those antigens and toxins. And I compare it to hay fever. We're all exposed to the same pollens in hay fever season. Some of us walk around with swollen, red, runny eyes, nose is blocked, and the next person doesn't know about it. And that's genetics. The immune system is not aware of it. So this is where gum disease comes in. If your immune system is geared towards identifying the bacteria in your mouth as a threat and tries to get at them, then you have an inflammatory process, which in the end results in bleeding gums and breakdown of the attachment of the gums to the teeth. And then you get pocketing, which causes bone loss as well, and eventually you can get loose teeth and lose your teeth. So when we as dentists poke your gums, that's what people like to say, we use an instrument like that, which is calibrated, and we look at that little area where the teeth and the gums meet. The gum finishes in a little collar that's not attached to the tooth, and that should be about 1.5 to 2 millimeters deep. Healthy gums on this side, nice and pink. Red gums that side, inflammation. Now we've got these little fibers that attach the gum to the tooth and the tooth to the bone. Very strong, but they need healthy oxygenated blood. When we have that inflammation, a lot of stagnant blood, not much oxygen that gets to it, and then we start to get breakdown of those fibers, and that's how gum disease develops. So gum disease is when we have the gums pulling away from the teeth. We get scale, calculus that builds up on the roots of the teeth, which you can't remove with your toothbrush anymore. And that's what we as dentists or our hygienists, who are the specialists in doing this job, clean away. The scale in itself is not going to cause your gums to recede or pull away from the teeth and causing pocketing, but it creates an ideal environment for the bacteria to hide in. So you do need to see your hygienist or your dentist every 6 months, ideally, to clean away the debris so that it's easier for you to clean at home. Cleaning at home is more important than your visit to the hygienist or the dentist. I've made the calculation before, but I can't remember it exactly now, and in a leap year it's different as well. If you brush twice a day for 2 minutes at a time, you're spending something like 24.2 hours a year in brushing your teeth. Now, that time is much more important than your half an hour in the dental chair when you see the hygienist. So please do your home care, brushing, flossing. If you can't get the TP brushes through, flossing. If you have an emergency in this time, look at our website, tuddenroaddentalsurgery.co.uk, and there'll be some advice how to manage minor emergencies, a chipped tooth, a broken tooth. You can get kits at Boots and these places where you can patch a tooth. Sensitivity, Sensodyne toothpaste or Colgate Sensitive. After you've brushed in the evening with a clean finger, if you rub a little bit around the neck of the tooth where there might be some exposed dentine which is not protected by the enamel, if you leave the toothpaste on there, the chemicals in the toothpaste which reduces your sensitivity has a longer time to work on it. And hopefully that'll see you through until you can get back to your dentist and have any problems treated. So in the meantime, everybody stay safe, stay healthy, and we look forward to treating you and seeing you after all of this is over. From all of us at the Tudden Road Dental Surgery, good night.